Hello and welcome to this short presentation on headache prophylaxis. This is part of the Severe Headache Expert series. My name is Raeburn Forbes and I'm a practicing neurologist who helps family doctors look after people with severe headaches. Prophylaxis is just another word that means prevention, and the aim of using medicines in this way is to reduce the intensity and frequency of headache attacks. It's crucial that you know what to expect, and a ballpark figure is that any successful prophylaxis medicine will reduce the intensity and frequency of headaches by about 50%. Headache prophylaxis is not a quick fix. Headaches will still happen from time to time, and you need to realise this so that each headache, if it does occur, does not feel like a failure. It still is very important that you deal with medication overuse, and you must check your lifestyle to make sure that you're following the principles of a headache-friendly lifestyle. When you're using headache prophylaxis, it's very important that you start low, build the drug slowly, get to a dose that you can tolerate, and then stick with that dose for at least 8 and preferably 12 weeks. Here's an example using a drug called propranolol. You would start this at 40 mg once a day. Each week you add in another 40 mg until you get to a maximum tolerated or a maximum of 40 mg 3 times a day. If one 40 mg tablet a day is all that you can tolerate, you stick with that. If, however, you can push higher to 80 or 120, you use the higher doses. You keep going, as I've said, for 8 to 12 weeks, and you reassess your situation. Have the medicines worked? Are the frequency of headaches reduced to a level that is satisfactory for you? Bearing in mind that we can only honestly expect at most a 50% reduction. Here are the medicines that I would commonly recommend, although there are many others, and new ones will continue to appear as the years go on. Propranolol, which is very familiar to most family doctors, as is amitriptyline. Topiramate, however, would usually require at least the written instruction or verbal instruction of a specialist. Nonetheless, it can be very effective if it is tolerated. You need to be aware that any medicine you use over several weeks may well bring some side effects. Propranolol, for example, might make you a bit lightheaded due to a drop in pulse or blood pressure, or give you cold white fingers due to a spasm in blood vessels in the finger called Raynaud's, or you might get vivid dreams. Amitriptyline tends to make people quite sleepy, or might give you a dry mouth, and topiramate can cause tingling in fingers, toes, or around the lips. You might even lose weight with topiramate, and some people will get a sudden change in mood or personality, which can feel quite frightening. So what should you do? If you're having more than one disabling migraine headache per week, you should probably consider talking to your doctor about headache prophylaxis. You need to ask yourself, is a 50% reduction in headache episodes worthwhile? Have you the staying power to persevere for 8 to 12 weeks? Have you already followed the steps in the Severe Headache Expert series, such as video 1 on stopping overusing painkillers, or video 2 on the headache-friendly lifestyle? And will you remember to reassess the situation in 8 to 12 weeks? There's no point continuing medicines long term unless you clearly see a benefit. The next video will look at an acute headache rescue plan, which are steps you can take if an acute headache appears that will greatly increase the chance that you'll get the pain under control quickly. If you want more information, check postings on Google+, Facebook, and there are many more videos that will appear on the YouTube channel. There is also a monthly newsletter if you wish to subscribe via the Severe Headache Expert website.